Hi everyone, I'm Dr. Powers here at the Ward Institute, and we're here today talking about otoplasty. So what is otoplasty? Otoplasty is a surgical procedure. The other name for it, the common term that's used, is called ear pinning. And what it is when we go in and reshape the cartilage in order to make sure that the ears look less prominent, or making sure that they look like they're sticking out less. So for an otoplasty, the entirety of the procedure takes anywhere between 1 to 3 hours, depending if we're doing one ear or two ears. And that's also a question that we often get. Can you get one ear pinned back so that it matches the other one? And the answer is yes. Or sometimes patients have prominent ears on both sides and they really do need both ears pinned back. So what to expect for the procedure? You come in and you go home the same day, so it's performed as an outpatient. When you come in for your consultation, we will take a look at your ears together and we'll decide on the most prominent area of the ear. Sometimes there's two areas that are involved, and that means that you either have extra cartilage in that area or a fold in the ear didn't form. Sometimes it's just that the ear fold didn't form itself. Typically our patients after an otoplasty will have a head wrap in place for approximately 1 week, and additionally they will have some sutures on the back of the ear. Most of the time, all of the surgery that needs to be done can be accomplished through a cut through the back of the ear. The majority of our patients feel that that head wrap is pretty snug, which it needs to be in order to have that area heal. Your head wrap will be removed at 1 week post-operatively when you come back in to see us. It's normal to have swelling or bruising around the ear, as well as some pain or a mild headache after the surgery for approximately 1 to 2 weeks afterward. Your final result will not be apparent until about 4 to 6 months after the surgery, and that's because a lot of that swelling needs time to come down. One of the most common questions that I get is what age is appropriate to have an otoplasty? And the answer really is after the ear has about 80 to 90% of its full growth. We tend to say that that is around age 6 or older. If people wait till they're older, so if they're in their 30s, it's a little bit more difficult for us as surgeons to work with the cartilage because it can become brittle. So typically a lot of our patients are anywhere between 6 all the way up until 18 and into their 20s.